Okay, so we are going to be working on the CMC abduction of the thumb. Following an injury, the patient has a limited abduction, so we're going to work on increasing that. So we are going to be working with a convex metacarpal on a concave trapezium, and so the roll and slide are going to be opposite. And so working on abduction, we're going to be applying a posterior glide. And so to do that, I'm going to have the patient's shoulder flexed and elbow flexion. The ulnar components are going to be stabilized on the table, and her wrist is going to be in neutral. The open pack position for the carpal metacarpal joint for the thumb is just a nice relaxed position. So that's in between flexion and extension and ab and abduction. So just a nice neutral position. And so I'm going to be stabilizing the wrist and the trapezium while grasping on to the metacarpal. So first I'm going to be distracting to assess the joint mobility. So I'm going to distract, asking the patient, do you have any pain with that? Okay, no patient there, so we can move into treatment. And so for grade 1, I'm going to distract and move or oscillate before I feel any resistance. For grade 2, I'm going to distract and move into the resistance and back slowly. Now, because we're following an injury, that's probably where she'd feel pain. If she did feel pain, I would stop. If she did not feel pain, I could move into a grade 3. And so for that grade 3, I'm going to distract and move into maximal resistance and move back to the beginning of resistance. Max resistance, beginning of resistance, nice and slowly. And then for a grade 4, I'm going to distract, move into maximal resistance, and oscillate in that position. And that would hopefully increase her abduction.